Hey class, Mrs. Gilling back here again for your Unit 3 video assignment where I'm going to let you know about some careers in psychology. I just feel like it's super important for you to understand what you can do with all this information you've been learning. If it's something you've really enjoyed, if you're like, man, that psychology class was awesome. I really loved learning about how we are who we are and how we interact in groups and people. If you were just like, wow, this courses have been awesome, then I want you to pay really good attention. And even if you didn't, maybe you learned some cool things about what you can do with psychology. So here's just some more information about careers in psychology. But before I tell you that, you know what's coming, the joke of the unit. All right. A psychologist returned from a conference in Aspen Lodge, where all the psychologists were permitted to ski for free. Her husband asked her, how did it go? She replied, fine, but I've never seen so many Freudian slips. Get it? Because I don't know how much you know about psychology, but Freud, is really famous for Freudian slips. And all right, if you don't understand it, look it up. But it's funny because they're skiing and they're slipping. Okay, if I have to explain it, it must not be that funny. But I really like that joke. All right, moving on to careers in psychology. So here's this super cool chart that you can find in the full course. I know this is an alt course. In the full course, there's this chart. I really wanted to show it to you guys because it is pretty cool. So one of the first career opportunities you have with psychology is being a psychiatrist. This is a treatment provider for psychological disorders. So a psychiatrist conducts thorough psychiatric evaluations. They develop medical treatment plans based on diagnoses. They prescribe medications and they evaluate treatment results. So, when they talk about famous psychiatrists, when you're watching like those crime shows and they're like, oh, they went to psychiatrist. These are kind of the people you think about when they're like lying on the couch talking to you about their day. That's usually what you're thinking about when you're thinking a psychiatrist. Similar are psychologists. Now, psychologists differ a little bit. They focus more on the providing the diagnoses to the different problems, and they specialize in more serious conditions and behaviors. They So just going down that list, they evaluate patient mental health to provide diagnoses. They focus on a combination of patient interviews, evaluations, and testing. They specialize in more serious conditions and behaviors, and they offer a wide range of therapy for treatment of individuals or groups. There's also counselors. That's a different one. They provide assistance with less serious everyday issues, emphasizes talk therapy as a method of treatment, offers specialized care depending on their educational focus, and makes care available for people at lower cost than psychologists. So if maybe you've had a kind of a difficult time, I know like during the pandemic, counselors became such an important part of society. People were really struggling and just needed somebody to talk to help them process the things they were going through. And so many people turned to counselors for that help. And psychiatrists and psychologists are awesome too, but counselors are more for those kind of short-term problems, and they can help with long-term things as well, but more of those short-term things that they can help you work through. We have school counselors that you've probably associated with. They fall into that category of counselors. There's job counselors. There's so many different kind of counselors out there that you can work with. And then there's also family nurse practitioners. That's like the people that you go to when you go see the doctor. They're also involved in treatment of psychological disorders. So the family nurse practitioner focuses on promoting health and preventing disease in patients. They try to help it so you can avoid some of these psychological disorders. Not that you can ever necessarily avoid them completely, but there's ways to help so that they're not triggered as much. They emphasize the general well-being of people, offer various healthcare services, including medical diagnoses and prescriptions. You can often go to your practitioner to get kind of an initial diagnosis and some medication before they might send you on to a psychologist for additional treatment. And they work to treat people of all ages. There's another group of people I want to talk about that psychology is a great kind of jump start to get into this career. You definitely have to have a lot of psychology classes to do social work. So here's a few different types of social work you might choose to get into if you enjoyed psychology. There's child welfare. They help families provide a safe and nurturing environment for children and youth. Like when you think of child protective services, there's a lot of social workers that go into that aren't, I think sometimes they get a bad rep, like, oh, you're taking kids away from their family, but really their job is to help families to heal, and the ultimate goal is to help families stay together. And these social workers often will go and try to help families stay together by helping parents. And sometimes it doesn't always go that way. There's definitely some serious situations that happen, But the goal of the social worker is to help the children especially, but and try to help the whole family. There's substance abuse social workers. They work with individuals and families on ways to recover from addiction. Aging, they assist older adults with living independently, focusing on dignity and quality of life. Community social work, champion the rights of specific communities to achieve social justice. Mental health social workers, they provide licensed mental health services. And then there's healthcare social workers. They help individuals navigate the physical and emotional hardships of medical conditions. So if you just have like a heart of wanting to help people, social work might be an awesome psychology career for you to get into. And as you can see here, there's so many different avenues you can go to if you're interested in that kind of stuff. So here's some of the schooling you'll need for each of these things. The minimum education requirements for these treatment providers. So if you want to become a psychiatrist, you first have to get your bachelor's degree. So that's going to your 4-year university. Then you have to get an MD degree through a medical college. So you're a doctor at that point. You have to complete a residency. That's 3 to 8 years. And then you have to get state-specific licenses and certifications. So becoming a full-fledged psychiatrist does take a long time, but it is, if it's something you want to pursue, it's totally worthwhile to put in that time and effort. And they do get a pretty good paycheck at the end. A counselor, you have to get a master's degree with a few exceptions. There are a few counseling positions that you can get with just a bachelor's, and there's some that you might need even higher. But for the most part, it's your master's degree. So a master's degree is after you get your 4 years, usually with your bachelor's, then you go for a few more years to get some additional schooling. That's when you get your master's degree. You have a completion of an internship or practicum, completion of the National Counselor Exam, the NCE, and then acquisition of official state-issued credentials, which vary by state. For a psychologist, you need to complete your bachelor's and your master's degree. You need to complete your graduate psychologist training. You also need to get your completion of a Doctor of Philosophy, PhD, or a Doctor of Psychology. So you also have to get a doctorate degree. But on this one, you're not a medical doctor, you're a Doctor of Philosophy or a Doctor of Psychology. So that's kind of the difference between that psychiatrist or the psychologist. And then you also need completion of APA accredited programs depending on your state requirements. So every state's got their different licensing things. For social workers, you need a completion of your bachelor's degree. So again, going to that 4-year university, or get your master's degree for clinical social work if you're wanting to do it even higher. You need to complete field work experience requirements. So that's kind of like an internship where you go into the field and you're actually working with people and learning those skills while you're being supervised. There's acquisition of social worker license. So you got to get a license, and then additional professional certification. It's optional, but for like, if you want to like advance to the next level, or if you want to do it like specifying, like what's the word? Specialize. That's the word. If you want to specialize in something else, you may want to attain those things. With each of these things, every year you kind of got to learn more things, keep up on it. I know it sounds like a lot of work, but if you like psychology, then you'll enjoy the work. You'll enjoy the schooling that it takes. I also wanted to show you just what it takes to become the nurse practitioner, since we talked about them a little bit. Here's just a little chart that shows what you have to go through to become a nurse practitioner. So first of all, you got to go to high school, finish that, and then after high school, you would become an RN. That's one of the ways to do it. And you become an RN by going to a college. You can become a registered nurse by doing a 2 years associates, but you have to get the bachelor's degree if you wanted to move on to become the actual nurse practitioner. So get your RN, your registered nurse first, and then you need to get your MSN, that's your master's in the nurse practitioner, by attending a program. And then you need to attend nurse practitioner specialty certification program and get certified through the ANCC or AANP. There's so many acronyms, right? So this is the step if you're a high school graduate. If you have gone to college, but you don't have a nursing degree, there's a different step you can take. So you have to become an RN by attending a second degree program. So you have to go to a different school and take their program. And then you need to complete the same things that you needed to complete over here, get your MSN. And you could become an RN by attending direct entry MSN program. There's just a bunch of different programs and ways out there. But I think the biggest thing for you to take away from here is that you're going to have to go to college to get the RN things and then do some more schooling, become a nurse practitioner. Takes some time, but also valuable. While it's not necessarily in the textbook readings, I also want to let you know that maybe you're nervous about schooling, but you still like psychology. There's so many other career opportunities out there and volunteer opportunities out there that can help people. Maybe you volunteer at a nursing home to work with elderly people and to talk to them about their days. As you've learned in some of these courses, they can be lonely, and having people to just sit and talk with them is a great way for you to use some of the things you've learned in psychology. There's at-risk youth that just need people to listen to them. There's lots of places that have counseling programs that need people to go in and just help some of these struggling kids. And you can go in and just be that, not an official titled counselor, but somebody that goes in and works with them and helps them meet certain goals. There's voc rehab, where oftentimes you can go in and help people that struggle with jobs and need help learning how to do a job. You don't necessarily have to have a full-on degree to do things like that and help with them. So there are lots of community options out there to utilize psychology as well, without even getting that 4-year degree or even further, as you see with like the nurse practitioner stuff. But if you love it and you are excited about schooling, don't hesitate to pursue any of these things. If you have any questions at all about psychology careers, let me know. I can hook you up with the school psychologist, and she can give you some more insight. I can share some more resources with you. But thanks so much for watching this video, and please let me know if there's anything I can do to help. Thanks, guys.